Hi, my name is Erin, and I'm a post-professional occupational therapy doctoral student at Mass General Institute of Health Professions, and I'm an occupational therapist at a behavioral health organization serving children and families involved in the child welfare system. Today, I'm going to share information about a very important bill, the Mental Health Professionals Workforce Shortage Loan Repayment Act of 2021, and what you can do to support it. Believe it or not, you can make a big difference in under 5 minutes from the comfort of your home. This bill was reintroduced to Congress on May 12, 2021 by Senators Tina Smith and Lisa Murkowski and Representatives Grace Napolitano and John Katko. And the goal of this bill is to increase the number of mental health professionals working in underserved areas by providing loan forgiveness to mental health professionals who provide direct treatment or recovery support to patients with or in recovery from mental health disorders and practice in areas where there are shortages of mental health providers. The loan forgiveness is up to $250,000 per individual and is reimbursed in sixths on an individual's work anniversary, so over the course of 6 years. For those of you who are occupational therapists, this includes you. And this is actually a big deal because including OTs in the list of mental health providers includes OT within a statutory definition of mental health provider, which helps with efforts to expand OT's role in mental health. Of course, if we increase the number of mental health providers, then we're increasing access to services and thereby hopefully increasing quality of life for our clients. To give some context to the current climate, right now, there are about 105.7 million Americans living in a federally designated mental health professional shortage area. And these shortages of mental health professionals are across all mental health specialties, and this is especially true in rural areas. In 2016, the Health Resources and Services Administration projected that in 2025, we would be 250,000 workers short in the behavioral and mental health field, and that was pre-pandemic. Clinically, almost a quarter of all adults with a mental illness reported that they are not able to receive this treatment they needed. This number has not declined since 2011. Some of this is due to shortage in mental health providers. When we look at our children, 9.7% of youth, or over 2.3 million youth, cope with severe major depression. Depression in youth often co-occurs with other disorders like substance use, anxiety, and other behavioral issues. The number of youth experiencing severe major depressive episodes increased by 126,000 from last year's data set. We need trained mental health workers, and we need them available. The risks are high. If this goes untreated, we're looking at worsening issues with more complications, both long and short term. Potentially long-term physical issues can include pain, chronic physical changes, brain changes, obesity, heart attacks, strokes, cancer risk, premature deaths, just to name a few. Untreated also includes decreased quality of personal relationships, things like isolation, losses of friendship, failure for new relationships, divorce, other decreased quality of life issues, workplace absenteeism, ability to pay bills on time, difficulty maintaining homes, which can lead to bankruptcy, homelessness, loss of families, increased likeliness to become victims of crimes, of being incarcerated, having accidents, developing substance use disorders, and harming themselves, including attempting suicide. In fact, the vast majority of suicide attempts are associated with untreated mental health disorders. I mentioned this is a reintroduction bill. You see, a bill has to be passed by both the House and the Senate in identical form and then be signed by the President to become law. And that's in a 2-year cycle of Congress. Otherwise, it dies with that Congress. It doesn't get to move on to the next Congress. It has to be reintroduced and, in a sense, start over. And that's exactly what happened with this bill. This is actually the third iterance of the bill. It was first introduced in 2018 in the 115th Congress, and then again in 2019 in the 116th Congress, but didn't get voted on in either, so died in both. Time matters. When you act matters. So I'm asking you to scan this QR code right now, which will prompt a page for you to fill in some minimal information about yourself. Once you add information, click Submit, and it will generate a pre-written advocacy letter requesting endorsement of this bill from your local Congress members. You're able to make edits to the text as you see fit. Once you're satisfied, click enter and you're done. When your congressman or congresswoman publicly endorse a bill, it's like saying it is important to them. And when enough members of Congress do this, then it's more likely to get voted on. This is especially important because of that 2-year window I mentioned. I've recorded a brief video for you to see how quickly and easy this is. Please feel free to follow along as I fill out the information. I invite you to share this video and the QR code with your friends and colleagues, and want to thank you in advance for taking the time to advocate for this very important bill. Remember, as the wise Dr. Seuss said, unless someone like you cares a whole awful lot, nothing is going to get better. It's not. Have an amazing day.